Shri Krishnavagishayatishwarabhyam Samprapta Chakrankana Bhashyasaram Shri Narendra Yatau Samarpitasvam Shri Krishnayam Guruvarya Nide Virodhe Kartike Mase Shatatara Krutodayam Yoga Acharya Krishnamacharya Guruvaryamaham Bhaje Krishna Suri Daya Patram Jnana Bhushanam Srimati Katanatharyam Vandeham Yoga Deshikam Shri Gurubhyo Namaha. Namaste. On behalf of the Krishnamacharya Yoga Mandiram, it gives me great pleasure to present to you certain insights about our approach to individualized yoga therapy, specifically focusing on issues with regard to the knee pain and allied issues. As a center, as a very well-known center for yoga and yoga therapy, the Krishnamacharya Yoga Mandiram receives a large number of care seekers, specifically seeking some relief in the management of musculoskeletal conditions. And among the vast range of musculoskeletal conditions, knee joint issues, specifically osteoarthritis, rheumatoid arthritis, and other knee-related issues take up a significant amount of our interventions. And so here we will explore some of these adaptations, focusing specifically on management of knee pain. I must emphasize here that what we will be discussing are certain suggestions. These are not intended to be prescriptive in nature, because our process of designing a course plan for individual care seekers requires us to consult with every care seeker one-on-one in order to assess their current health status, their needs, capabilities, expectations, and other factors such as diet and lifestyle. What we will explore are certain suggestions, certain ideas about how classical postures such as bharathanatyam, Tadasana, Virabhadrasana, also Apanasana, some select postures, how these may be adapted for the purpose of one-on-one individualized yoga therapy intervention. Let us start off first seeing an adaptation of Tadasana. I request my colleague and senior yoga therapist Purnima Kavekar to show these postures to you as I give her the instructions. Tadasana, I think we're all familiar with the palm tree posture. Specifically, when we are working with people who have knee issues where balance might be a bit of a problem, one could use the support of a wall. The palms are placed firmly on the wall, feet slightly apart. In this position, on the inhale, one goes up on the toes, you rise up on the toes, and on the exhale, slowly lower the heels to the floor. Let us see this a few more times. Inhale, on the toes, and as you exhale, slowly lower the heels to the floor. Inhale and exhale. As you can see, this is a very useful stretch that works on the entire spine, also the legs, provided there is no pain. At every point, one has to assess for the comfort level of the student. If there is pain, then that technique may not be used then. It can be deferred to a later stage. We will also now look at another technique where we are going to use the support of a stool, a modification on two postures, the sequence Parshva Uttanasana and Virabhadrasana. Here, this modification, specifically this combination of asanas, the focus is on working on the knee, and so there will be a stretch And after that, a flexion of the knee, where we combine these two postures, one a forward bend and the second a back reach. Now, classically, these postures may be used for a number of other purposes. Here, specifically, this sequence is intended to strengthen the knee joint. But one point of concern that I must note here is that when there is pain, when there is severe pain in the knee, then it is better to check whether the use of this sequence reduces or aggravates the pain. Specifically, if there is pain, it is better to move towards something that is pacifying in nature and use this kind of a sequence more for the purpose of strengthening. Remember, as I have mentioned, the choice of asanas is highly dependent on the level and the capacity of the hips. Starting from the samasthiti position, one step in front, your leg is placed one step in front. The front leg, usually we start with the left. The back foot is turned slightly outwards. The body is turned to face the front knee. Weight equally balanced on both legs. On the inhale, arms up from the front. On the exhale, one has to bend forward, placing the palms on a stool or a little table of a comfortable height in front. Now, in this posture, it is recommended not to bend the knee, to specifically keep the front knee straight. On the inhale, now bend the left knee, the knee in front, and arch the back. Throughout the sequence, the eyes may remain open. On the exhale, straighten the knee and bend. Return to the previous position. On the inhale, arms leading the movement, you come up, straightening the spine. On the exhale, arms are lowered from the front. We will see this again before Purnima demonstrates on the other side. Inhale, the arms go up. Exhale, bend forward. Now, the height of the stool depends on the comfort level of the individual. Inhale, bend the front knee, arch the back. One must remember here at this point that the weight is not placed fully on the front leg. The weight has to be balanced. There is a slight bend to the extent comfortable. On the exhale, straighten the front knee, bend forward. On the inhale, come up, let your arms lead the movement. On the exhale, lower the arms. This may be repeated as many times as the consultant therapist requires necessary. Sometimes 3, sometimes 6 repetitions on each side. Again, depending on the case. Once done, step back, returning to the samasthiti position. Now, on the other side, what we will see is the movement adapted to begin from the forward bend position. In case of a care seeker who is unable to go through the entire sequence of raising the arms and bending forward, one could also start with the forward bend position, as you will see. So, the right leg can come front. Bend forward, place your palms on the stool in front. So, the starting position itself is here in case someone struggles with the process of bending forward. In this position, inhale, bend the knee and arch the back. Exhale, return to the previous position, straightening the knee. Again, inhale, bend the knee, arch the back. On the exhale, lower the head, and return to the bend position. Again, this can be repeated as many times as necessary. On the inhale, come up. Let the arms lead. On the exhale, lower the arms. Now, which version we are using again would depend on the person doing it. And this is one of the hallmarks of the individualized approach, is that the same posture can be modified. What can also be modified is going into and coming out of the posture, depending on the needs of the student. We now move on to the next. You can step back. we look at certain lying movements that we can use specifically to address knee pain related issues. When it comes to knee pain, one very good plane in which to work, very useful, is the lying plane because it takes the weight of the legs. Standing movements can be used to the extent necessary but not excessively, given that the person already has knee related issues. Whereas in the lying plane, the back is supported and a variety of movements are possible both to improve the flexibility of the knee, to work with flexion and extension. At the same time, gentle strengthening of the knee joint. And when we work with the knees, another important approach is to work above and below the affected joint. And so as we move with the postures that we use, you will also see some amount of engagement of the ankles because that is useful to strengthen the muscles that are associated with a particular joint. So in the lying position, for those who experience some pain, some tightness, a good rest position would also be to lie down with a pillow or a cushion placed underneath the knees. A very thin cushion, again to the extent comfortable. And in this position, when the knees are relaxed, there is support for the back of the knees. And so you could ask the care seeker to freely breathe in and out in this position. This can be used as a rest position. When resting, the palms have to be facing upwards and the feet are to be relaxed when resting. In this position, sometimes we might also work with the breathing, specifically where we work on lengthening the exhale. And so the deep diaphragmatic breathing technique is one that is often used in the KYM tradition. Just to demonstrate, one palm on the chest, one palm on the lower abdomen. Breathe in and gradually start working on lengthening the exhale. For instance, inhale, exhale 1, 2. Inhale freely, exhale 3 times. 1, 2. Inhale freely and exhale 4 times. 1, 2, 3, 4. Inhale and exhale 5 counts. 1, 2, 3, 4, 5, and so on, depending on the capacity of the care seeker. Again, the length can be varied. A longer exhalation will contribute to muscle relaxation, which in turn will help with pain relief. Now, in this position, what we could also do is a very gentle flexion and extension of the ankles. This can be done with or without arm movements. We will show you with the arm movements. So, on the inhale, arms are raised above. At the same time, extend the ankles outwards. Naturally, when this is done, the muscles around the knees region will stretch. On the exhale, bring the arms down. At the same time, flex the ankles inwards towards the body. Inhale. Exhale. Then different variations of this may also be attempted. We now move on to certain other postures that are likely to help with strengthening the knee and improving flexibility. Without the pillow, you can remove the pillow with both knees bent. From this position with the knees bent, on the inhale, one foot can be just moved outwards. On the inhale, slide the left leg outwards. The heel is moved along the mat or the carpet. On the exhale, the knee is bent towards the body. You could do it on the other side. On the inhale and on the exhale, bend the knee. Now, depending on the need, sometimes we would also like to engage the upper body. We could add the arm movement. This is subject to the need of each care seeker. We now explore the use of Apanasana using the support of a stool. Please observe this position where one lies down with the legs raised and placed on a stool about 1.5 feet high. Now, one thing I must explain here is that for those who have knee-related issues and are unable to lie down or sit on the floor, the same may be adapted to a higher surface. Generally, in the Krishnamacharya Yoga Mandiram, we have higher surfaces, cots that are at a slight elevation, and the caretaker lies on the cot and then places the legs in this position. Now, if someone doesn't have access to a stool, or if it's for some reason when we work with caretakers who sometimes are alone, have no other help, then pillows may also be stacked. The purpose being the rounding of the lower back and the total support of the knee joint. That supported movement of the knee joint will help to work in issues where there is stiffness, where we want to work with flexibility without causing any injury. So in this position, one could adapt the Apanasana technique. Here we will show you one leg Apanasana, Ekapada Apanasana, and also Apanasana using both legs with the support of the stool. From this position, inhale here. On the exhale, draw the left leg inwards, sliding the heel along the surface of the stool to the extent possible, to the edge of the stool. On inhale, the leg is stretched outwards, very gentle movement. On the next exhale, draw the right foot inwards towards the chest, sliding the heel along the surface of the stool. On the inhale, stretch the right leg outwards. We will see this once again. Exhale. The contraction movement is always on the exhale. On the inhale, outwards. On the next exhale, the right leg is drawn towards the chest. And on the inhale, outwards. We will now look at how both the legs may be engaged in the same movement. On the exhale, draw the knees towards the chest, sliding both the heels on the surface of the stool. On the inhale, the legs move outwards. Now, as the student does this, it is very important to monitor the comfort level. There should be no pain in the back. There should be no stiffness or discomfort or distress of any kind. And so one could adjust the range of movement depending again on the capacity of the student at that point of time. Let's see the same movement again. Inhale in this position. And on the exhale, slowly draw the knees towards the chest. On the inhale, outwards. And so on. This can repeat. Now the same flexion and extension of the ankles that we saw with the cushion under the knees can also be used with the legs raised in this manner. We will show you once. Inhale, extend the ankles outwards. And on the exhale, the ankles are flexed towards the body. It's important to work with the breath here. Inhale out. And on the exhale, the ankles come in. This can be repeated any number of times as necessary. We could add the hand movements as well. We will now show you a variant of Ekapada Apanasana, again done with the support of the stool. Bend the left leg, draw the left leg towards the edge of the stool. And to the extent comfortable, the left palm is placed on the left knee or anywhere on the leg that is comfortable to the student. The right leg is fully supported on the stool. On the inhale, raise the leg up to the extent possible. Now, the student may not be able to stretch to this extent, in which case they can stretch to whatever extent is possible. On the inhale, on the exhale, the knee is bent and the foot lowered to the surface of the stool. We'll see this again. Inhale. Again here one could engage the ankles as well. So the foot can turn towards you on the inhale. And on the exhale, down and out. So these are adaptations that we can weave into the same posture. On the inhale, stretch the leg out. We will see this on the other side as well. Inhale here. On the exhale, bend the right leg, drawing the knee towards the chest. The heel is placed at the edge of the stool. Right palm placed on the top of the right knee. On the inhale, raise the leg up to the extent comfortable. On the exhale, down. See, now why we do this is because for many people, to raise from the base, from 180 degrees upwards, might cause a little bit of strain, specifically if the back muscles are not as strong. Whereas when you elevate the legs to this position, then the range to which the leg has to be lifted is less and therefore relatively more manageable with less effort. We will see this again. Inhale, the knee is stretched upwards. One could also engage the foot, so the foot can be turned towards to face you. And on the exhale, out. The knee is bent. And so on. This may be repeated again 3, 4, 5 times as necessary. On the inhale, the leg is stretched outwards. Now again, using the stool for support, we will now demonstrate Urdhva Prasrita Padasana, both legs. We have seen one leg Apanasana to Ekapada Urdhva Prasrita Padasana just now. We will now show you both the legs raised. This would be a progression from the previous as and when the student is ready. Please bend the knees and draw your legs towards the chest. Both heels placed towards the edge of the stool. Palms are placed on the knees in this position. On the inhale, raise the legs up. Slowly to the extent possible. On the exhale, the legs are lowered and the heels are placed on the surface of the stool. As you can see, the distance makes a difference in terms of making the movement easier. We'll say this one more time. Inhale, the legs are raised upwards. And on the exhale, lowered. This posture again will be repeated as necessary. Stretch the legs onto the stool. Arms relaxed. Palms open. Feet relaxed and open. Now this is also a very useful rest position like we saw with the pillow under the knee. Raising the legs in this position is also a very good restorative posture where one could direct the attention to breathing or bring in other techniques such as visualization, mental chanting of mantra. Various other techniques may also be woven as necessary. Another series of postures one could explore are the prone movements. We commonly use Bhujangasana, Shalabhasana, etc. Those typically more adaptable for back-related issues. But in the prone position, we can work on the knee joint, again with a little flexion and extension. Single leg and then both legs. We will watch this as well. On the inhale, bend the left knee towards the chest. The inward movement here is on the inhale because there will be a stretch of the spine, and the exhale movement will be the opposite. On the exhale, lower the leg to the foot. The other leg now. Inhale, bend the right knee. And exhale down slowly. This may also be done with both the legs. We could alternate. Now, on the inhale, both knees are bent towards the chest. And on the exhale, lowered. We will see one more sequence of the same thing on the left, right, and both the legs. Inhale, bend the left knee. Exhale, straighten the knee. Inhale, bend the right knee. Exhale, straighten. And now both. Inhale, bend both legs. and on the exhale, straight. So this is another option that we could consider when we want to work on strengthening the knees and also enabling the ease of flexion and extension. What we have seen here are only certain suggestions of how some classical postures may be adapted to specifically work on the knee joint in this particular demonstration. I must emphasize here that not everyone with knee pain or related issues is able to sit on the floor. Being seated on the floor is only for the purpose of the demonstration. But where necessary, our students are asked to sit on a chair or use a higher surface like a cot. Now, also what we've seen are only adaptations of some postures, as I mentioned at the outset. This is not prescriptive but suggestive to indicate the approach, the generalized approach. Specificities depend on the consultation, depend on the interaction between consultant and care seeker and the feedback that we receive. And so while asana may be an important component with which we work when it comes to musculoskeletal issues, the fact remains that many care seekers have multiple issues where there is pain, there might be certain, there might be stress, there might be anxiety, there might be other related or non-related issues, other comorbidities, say hypertension or high sugar levels or cholesterol. Because in general, it's not likely that those who seek yoga therapy interventions come to us with only one clinical condition. Very often, we find other conditions that are also addressed simultaneously. Also, a fact to be remembered is that in the KYM approach, layered practices, asana might be a core component, but we don't work with asana without the breath, as you see. And so breath integrated practices, pranayama as necessary, specifically in the management of pain, we work with an extended exhale. Depending on the need of the care seeker, we might add bhavana, visualization. We might add mantra components. Again, the mantra is introduced after discussion with the care seeker about what their area of interest is, what their faith is, and accordingly chants may be integrated and so on. And so a variety of adaptations are possible. What we have, both Purnima and I have tried to show you in this episode or in this session is certain suggestive adaptations that are used. As always, please remember, individualized yoga therapy requires the course to be designed and taught to an individual care seeker after a thorough assessment of their needs and capabilities. And the practice also evolves over time. It is not a static practice. The practice evolves depending on the feedback, depending on the change in the symptoms reported by the care seeker. So thank you for being with us and watching this presentation.